I'm Patti Cullen, President and CEO, and I am the backup inside scoop giver. There's no such thing as inside scoop giver. I'm the backup staff being filmed for Inside Scoop. Just a few minutes ago, Governor Mark Dayton formally released his budget for the next biennium, which is fiscal year 2016-2017 biennium. As we anticipated, the budget includes very little funding for anything relating to long-term care and senior services. We were given advance warning that that was going to be the case. So our media statement that we sent out this morning reflects both the concern about the lack of information and proposals for seniors, as well as the willingness to work together. This is the start of the legislative session, so it's not a sprint, it's a marathon, and we have a long ways to go between now and the end. In our public statement, we said, Governor Dayton has used his budget message to focus on some specific priorities facing Minnesota. But as 60,000 Minnesotans will turn 65 this year and next year, and until at least 2031, the demand for care for seniors will continue to grow. We need to start the conversation immediately about how we are going to address the care of aging Minnesotans. The long-term care imperative and its members look forward to having this conversation with Governor Dayton, Commissioner Jessen, and members of the legislature. There is no doubt that we will be discussing the needs of aging Minnesotans as part of the final budget negotiations. That was our statement in response to the governor. The governor's budget focused primarily on transportation and kids. Within the Department of Human Services budget, he included requests for new funding for mental health reform, state-operated services, and a lot of children's needs like credits for daycare and Head Start program, pre-K programs, those kind of things. There were just a few pages of interest in the long-term care arena. If you link to the document on the website that Management and Budget put up on the Department of Human Services budget, each of the budgets within the administration has a place on the Management and Budget website. The Department of Human Services budget is 368 pages long, so if you like reading, it's a great read. 2 pages of that reflect new investments in long-term care. It's important to note that this is the biennial budget. It's the base budget by which all spending is done. So they do change pages on new investments or reductions, and then they identify the core programs, same level or forecasted increases. So even though there aren't increases specifically in the budget as a change page, there are some increases in statute that will take effect this year based on what passed in 2013 in the last biennial budget. So without any other changes, since there aren't reductions in the budget, nursing facilities will see a slight increase October 1st based on what passed in 2013, about a 2.4% rate increase. Folks that serve individuals under the CADI will be glad to know that on July 1st there will be no longer caps on slots for CADI, which means there's a huge forecasted growth for individuals served under the CADI waiver, and that's for persons with disabilities under age 65. The new change items in the budget quickly, since there's just 2 pages, is long-term care purchasing and financing. It includes some work on research and development of long-term care financing reform products that came out of the Own Your Future work that we were participating in the last 2 years. There's also the establishment of an advisory center to help develop these products. There is also a provision of a pool of new money, an innovation pool, a new initiative to incent innovation in long-term care purchasing. So it would include outcomes that would need to be achieved before providers receive incentive payments. It's going to serve about 600 individuals at the max on that, and that's just a little bit over $1 million for the first year. So, like I said, the governor's budget doesn't include much right now for senior services. In this week's newsletter, I go through a little bit of background about what this budget means and how the legislature responds to it. This is the first volley in the budget discussions. When the new forecast of the economic forecast and budget forecast comes out in February, the legislature will use those updated numbers in order to develop their own budget. So the Senate will have a budget, the House will have a budget, and those two will need to be negotiated in a way that the governor is involved, because at the end of the day, if the governor does not support the budget, he can veto it or veto part of it. So they will base a lot of their budgets on what they see in the budget pages of the governor right now. And they'll have to figure out a way to fund other things that are their priorities, and hopefully seniors are one of them, as they develop their budgets in the House and the Senate. So stay tuned for further attractions. You do have the website on the governor's budget. They're starting this week, this afternoon, on starting to walk through the very detailed budget. This is the first time in history that the biennial budget will be over $40 billion. That's a lot of money, and so there'll be a lot of time spent on prioritization of that state budget. So for now, that's it for the Inside Scoop.